Welcome everyone to Women's Health Tech Wednesdays. I am your host, Nina Joshi. And with that, would like to formally bring on our guest for today, Cindy Chun, who is a senior advisor at WD Home. As you know, we love questions here at Women's Health Tech Wednesdays. So if you have any for Cindy during the conversation, please use the Q&A or the chat feature, and I will make sure that we get to it. With that, thank you so much for being here, Cindy.
Thank you for having me. This is so exciting.
I can't wait to dive in and really learn more about what you're building. But I think first things first, of course, the most important question to ask is if you could share with us a little bit of an introduction and a background. I would love to learn your career journey and kind of what it took to get to where you are right now as a senior advisor.
Sure. So I spent most of my career, still am, in public health and
Mhm.
science. Did a lot of work in human health risk assessments, doing research, a bunch of different things. I did some work in population health, like looking at different subpopulations, including senior adults, older adults, and also did some work to support development of chemical regulations. So that's majority of my career. But earlier this year, I joined the Walking Doctors team, which is behind the WD Home product platform that I'm here to talk about today.
That's incredible. And I think on that note, before we dive into WD Home, I really like how you have, a very wide, different perspective. And I think maybe your public health and some of the work that you've done, I can imagine has probably given you a really interesting lens to kind of WD Home and maybe just the startup space at large.
Yeah.
Would love if you could chat about that
Yeah, let
experience or
me
how you've seen it.
maybe I should speak a little bit more about also what I've been doing at WD Home. So I know it says I'm senior advisor to the CEO for WD Home, but I find myself doing a lot more than that and just wearing multiple hats.
Hmm.
I advise the CEO on business development, um, did some competitive analysis, marketing, s- partnership development, funding opportunities.
Wow.
Um, Lately, I've been more in charge of the research that we have going on to to demonstrate the purpose of WD Home, how it helps drive positive health outcomes, how it helps caregivers in supporting and caring for their care recipient or their
Mhm.
older adult. So it's been an exciting journey. And I just saw a heart come up.
We all
Um,
resonate.
yeah, I think, my lens of public health where we prioritize on the general population, on protecting the public in terms
Mhm.
of their health and reducing their risk or just having a healthier population. That's where I come from, and that's what I drive towards in WD Home.
Wow, that's incredible. And can you tell us a little bit more about, WD Home? What is the problem that you're trying to solve for, and just a little bit more about the platform in general?
Sure. So WD Home, it's an app or platform that you can use via the your computer. And so I think of it as like a care coordination app, a communication app, a tool for caregivers
Mm,
to empower them, to help them be more efficient and to support their roles in caregiving because it's such a hard job.
mhm,
Um, and so we developed this app to help a caregiving network, be just more like, I guess, organized,
mhm,
um, and and communicate out to the care, support them because it's not just hopefully it's not just a one-man team.
mhm,
Hopefully
mhm.
there's a team that can work together to support the caregiving of someone. So that's the app. It's available on Apple, it's available on Google. You can download it, play with it. It's free. I should mention it's free.
Hmm.
There's yeah, lots of things in that app that that caregivers can use, tracking their food, their nutrition, making sure that your loved one is being having regular daily nutrition, tracking their rest or their activities, even toileting. Like that's something that's really important to some
Hmm.
older adults that we need to track that they're excreting every day. And also their medications, super important.
Hmm. Definitely. I'm so curious because I mean, we all know, I think caregivers are very much the unsung heroes of healthcare, I think more largely. But can you share a little bit more about some of the challenges that you've seen that caregivers face when it comes to maybe caring for a sick parent or just an elderly person, and how, you really see WD Home as kind of being that bridge or that solution?
Yeah, well, I can name one challenge to start. There's, like you said, a lot.
Hmm.
And this stems from like a personal experience. In this past year, my grandfather passed away, and I wasn't the primary caregiver, but my uncle was.
Hmm.
And he I saw how he had to communicate out to family, local family in other states, including myself, to my dad, on the status of my grandfather, and just all that communication out to other family members took a lot of time.
Hmm.
And we're not all in the same time zone. A lot of
Right.
times, very stressful, a lot of um, updates. So one great thing in WD Home is that it has a communication panel where he could have used that to support giving those updates. Or,
Hmm.
if we had added our family members, relatives to WD Home as part of the caregiving network, they can also see the updates in various um, care panels. We call them care panels.
Hmm.
um like how is grandpa's blood pressure, that was something that we were monitoring um very tightly. Every time someone visited, we kind of like took note of the blood pressure, and
Hmm.
communicated out to everyone. But it would just be really nice to have that information all in an organized fashion. um yeah, so communication is one thing, tracking is another thing, not just for ourselves, but to have that information and all that data um ready to present to a healthcare provider when you get a chance to talk to the doctor or like discuss the patient or the loved one in this case. I find that very useful. So my grandfather passed a little bit before WD Home was officially launched, but I wish we had that tool to help our caregiving journey, and also just help reduce that caregiver burnout and stress. And yeah, it's a lot.
Hmm. Thank you for sharing that. I mean, I feel like so many of us have, even as you were talking, I could even think of my own like personal family, those dynamics when I think it comes to caregiving. So thank you for sharing that story with us. I think a lot of people really resonated with that. And I'm also kind of curious too, like how do you see technology, I think more broadly, kind of transforming or really supporting in-home care for the elderly? What are some of the key benefits that you see with just technology at large?
Yeah, well, our population is aging, and I think there's definitely like a greater need for homes that are I want to say custom, but kind of built more for like aging, like less mobility, aging in place. You'll see it nowadays if you go into a home where someone is aging in place. Still, there's a lot of cameras, like cameras at every
Hmm.
angle.
Totally.
And these cameras, I mean, they're fancier than your baby camera. Can do fall detection. They can log like how long has grandpa sat in that chair for?
Mm.
Log their like time stamps of where they're situated, what they're doing. So their activity is a measure, a metric as well. And so I see WD Home as kind of like pairing with all these other technologies um,
Oh.
in tracking, like it's becoming more like, okay, well, if we have these cameras just like in a hospital or in an assisted living, like let's have these software or tracking or communication tool to help that environment where they can age more comfortably and the ultimate outcome is to lower their risk of hospitalization, to have them age at home um, in the best way possible with respect to their health and
Mhm.
also their social and emotional um, metrics as well.
Definitely.
Yeah.
Yeah, I can definitely see, I think not only helping to divert maybe patients or elder, population that would quote unquote be patients from hospitalization, but also I think supporting like the mental and physical aspect of it as well. Of just I know there's been a lot of stats or research that's shown that folks that are kind of aging in place or kind of have the ability to age in place and like what that means for their mental health, things like that.
Yeah.
So I think that's
So
incredible.
I think like, on one hand, it's yes, we want best out health outcomes.
Mhm.
And we want our older adults to age in place comfortably and best health outcomes for them. But it's also for the caregiver as well
Yeah.
because they're the ones who are doing the hardest job
Hmm.
to lower their stress, to help them, to give them a tool to do their job more less stress. I'm not going to say that it's not going to be stressful still with less stress, but to empower them as well and I think also just give them a way to better organize their job,
Yeah.
all the things that they do in the job and all the things that they need to keep track of.
100%. Yeah, I think caregiver burnout is something that is very, very real. And I think even on that note, would love to learn how you are kind of approaching or how WD Home is approaching, caregiver burnout, what are kind of the trips, tricks, tools that you have or thought through in your platform to really, be that support system for the caregiver.
Yeah, so caregiver burnout, it's so real. Like I think
Mhm.
part of I've spoken to a lot of caregivers and sometimes they just want to be heard. They just want to
Mhm.
have talk to someone. They
Yeah.
they need a support network. And so one vision with WD Home is when you join the app and you invite your family members or whoever else is in the caregiver network for the resident or the older adult that in this app I mentioned the communication tool or the
Mhm.
communication platform or panel. That's where you can support each other and give each other words of encouragement and
Mhm.
and that we're in it together.
Yeah,
Yeah.
absolutely. And I'm also very curious because I know, there you kind of hear, and I know there's been kind of some research that shows that women kind of tend to be more often than not the primary caregiver,
Yes.
in families, right? The sandwich kind of component of having to take care of maybe kids and family, but also parents or others. I would love to learn a little bit more. I mean, is that a specific angle that you all kind of thought of when you were designing WD Home? Is there anything specific that you're kind of leveraging to address maybe that specific demographic?
Yeah, so like absolutely right, majority of the caregivers are women. In fact, you could also say like older woman.
Mm,
So we definitely, want not specifically that we're designing it for women, but
sure.
in in the design of the user interface, we want it as simple as possible,
Mhm.
as intuitive as possible.
Yeah.
Like there are there are seniors who are highly tech savvy. I have met some recently at a caregiving conference. I'm like, oh wow, you're so much better than my grandmother. Like you don't fit that stereotype. Let's not go with that stereotype anymore. But
Totally.
it's really important for us that this app and this tool is clean and simple, so it's easy for the caregiver to use,
Right.
easy for the caregiver to pick up and start logging what they want to track.
Mhm. Absolutely. It is very true. Like a lot of older folks are very tech immersed in a way that I don't think anyone really realizes. So I think that is a very, very real component of it.
Yeah,
Um,
the font whenever I like pick up their phone to help them,
oh, it's he.
yeah, the font is like super big, but they know where to go.
Oh, for
So yeah,
sure.
that's another thing, we want to make sure that we try to squeeze a lot in this little I don't know, was it seven? I don't know, is it your phone, whatever size it is.
Yeah, yeah, the
We try to
dimensions.
squeeze a
Yeah.
lot there, but we keep in mind like, okay, you can't make the font too small.
Yeah,
Yeah.
totally. The accessibility components of it, very, very important. Um, I would actually love, I don't know if you have or can share, but would love if you can share maybe like a story, like a success story, where WD Home kind of was able to improve outcomes, or kind of support caregiver, if you have anything like that to share.
Okay, yeah. We are actually, I guess it's still early stages. We're trying to do a study to
Oh,
like
wow.
in, where with real families and real caregivers
Mhm.
to show how WD Home is able to produce positive health outcomes, maybe like reducing hospitalizations or
Yeah.
reducing, health insurance claims, for example. But that's still kind of in the early stages. But what I could talk about is about this medication panel in WD Home.
Hmm.
Um, and we did a study on that too. So in the medication panel of WD Home, not only do you track what medications your older adult is taking, and the schedule that you're taking it in, when it's administered, all that. It also has this really neat feature, where it runs the person's medications, prescribed medications, against it's called the Beers criteria developed by the American Geriatric Society. And
Mm.
the Beers criteria um high it identifies it basically is a list of medications that are considered inappropriate, potentially inappropriate for older adults,
I see.
potentially due to like drug interactions, or that the side effects outweigh the benefit from taking the drug.
Mhm.
So the American Geriatric Society has this beer criteria where it helps practitioners know which drugs may not be the best prescription for older adults. So the app WD Home, it runs your loved one's medications through the Beers criteria and flags which ones are incompliant or could maybe considered potentially inappropriate,
Oh, wow.
may unnecessary, or may cause side effects.
Yeah.
And so we did this study where we had our app is being used in an assisted living community, and we have their medication. So we just were curious, like, out of all the residents in this assisted living, how many of them are taking drugs that are flagged as inappropriate, identifies inappropriate by the AGS Beers criteria? And
Hmm.
it turns out that about 70% of the residents are actually taking at least one drug that's not compliant with the Beers criteria, that
Wow.
it's not necessary for them to take it, or it might be dangerous.
Hmm.
And then, another question we asked was, well, out of all the prescriptions, for that these residents are taking. Like how many of these prescriptions are being flagged as inappropriate. Um, and and so that number came out to about 25%. Um, so this is still kind of wrapping up, but you can imagine if families took this information and this knowledge
Yeah,
to their practitioner and started a conversation of like deep
absolutely.
prescribing, you really do um it really gears towards positive health outcomes. One of the most common side effect or risk with these that we saw with these drugs that were being flagged was the risk of stroke. And then
Mm,
secondly was cognitive decline. Um, so that's in terms of like positive health outcomes
yeah.
with that medication panel in WD Home, I think that is a powerful tool in there,
Mhm.
powerful feature to use to like again keep your older adults safe.
Absolutely. Yeah, I think just seeing those stats is quite jarring. Just knowing that. And we definitely will need to have you back for a part two when you have that study released. I know you're still kind of in the early phases, but I think just sharing kind of the what the current state is, even with just the medication piece of it, I mean, I did not know that that was very crazy stats to hear.
Yeah, and so like I just want to I don't mind sharing a bit more. um so that's the health outcome side. I want to talk
Yeah.
about like the savings, the cost savings side. So we
Mhm.
looked at, okay, well, of these drugs that were being flagged, um, what are the costs of them under the Medicaid plan and the Medicare plan, and what about out of pocket?
Yes.
Um, so we found that, if patients were really to be deprescribed these drugs being identified as potentially inappropriate, it would render about like $7,000 per patient or per resident per year, if they deprescribe these drugs. And then under the Medicare plan, it's like 5,000 something dollars per year per
Mhm.
resident. So you can,
Wow.
yeah, and if you do the math, like the savings could be huge,
Hmm.
which, I wish that we could carry this further, because then not only is it like saving these health insurance plans, health insurance programs money, but that money could be allocated to other initiatives and other priorities.
100%. Wow. I think to your point, I think there's so many different angles when you think about like the benefits or even just the metrics from outcomes to savings to I'm sure there's so many other downstream things about like access that can really all be implemented. So I think it's really great too that it seems to be kind of a focus to really think about what are all of the metrics or what are all of the things that can be influenced by a solution like this,
Yeah.
which is incredible. One of the things that you had mentioned a little bit earlier that I wanted to touch on was kind of around like the collaboration or partnerships piece of what you're working on. I know you were mentioning, cameras or other devices, but more broadly, how are you kind of thinking about incorporating, cross-sector partnerships and things like that for WD Home?
Yeah, that's something we're always thinking
Mhm.
about. Um, and helping WD Home um, explored different partnerships, managed some pilot partnerships. One partnership we have right now is with a group in Rochester, Lifespan. So they're like a nonprofit organization supporting caregivers in that regional area, giving them workshops, tools, networking, connecting them to helping them with various programs, access to programs. And so they have a very large network of caregivers in Rochester, and they're very supportive of our tool, and they've also given us feedback that helped us ameliorate better our tool. And so it's these kinds of partnerships with who have caregivers that we're trying to reach out more to and develop.
Wow,
Yeah.
that's amazing. And
Because
it's great that there's
ultimately, sorry, yeah,
no,
ultimately,
no, go for it.
this is a tool for caregivers and and we want to get as much feedback as possible. We want
Yeah,
to make it work for them.
100%.
Yeah.
I think that's that. I think I kind of having that and them as the North Star, I think is always like a good move.
Mhm.
Um, and I realized we're almost at time, so kind of wanted to end with I think one of my favorite questions, which is if you have any words of wisdom or advice, and this maybe is for folks that are on the call that are maybe looking to, start up something that are aspiring founders or wanting to work kind of in the caregiving space. Do you have any words of wisdom for them?
Oh, if you want to get into the caregiving space, I would say you could like, it's funny, my first volunteer experience as a teenager was in a senior's home.
Really
Yeah, I know. It's how
funny. It's
interesting how
fate.
like things come around. So, you could always go to an assisted living seniors home and help out there because they need all the help they can get.
Yes.
Or if you know someone who is in that caregiving journey,
Mhm.
really they just want someone to talk to listen. And I find that a lot of them they like hesitate to share because it's possible that their friends aren't in that same stage, and it's hard to share that with someone who doesn't really understand or can't follow those struggles.
Mhm.
Um, so talking to someone who's in that journey, listening, um, yeah, I think that's just like that is the best advice I would have if they want to get into the caregiving technology, like see what the needs are there because it's a really tough job and definitely there's areas where it can be made more efficient or where
Mhm.
technology can help people's obstacles in maybe the actual caregiving job or navigating the programs or caregiving space.
Yeah. And I love that. I love how it's really about just like taking the time to listen. And I think that's just good advice, just in general, like more broadly. So I love that. I so appreciate you taking the time to chat with us today, Cindy. It was so incredible learning about what you're building. We'll definitely have to have you back to see how things are progressing and how they're moving forward.
Great. Thank you so much for having me.
Thank you, Cindy.